Really, thank you very much. If you've recently experienced body aches and sneezing, you're probably wishing that you found the time to go get a flu shot. It is the season for severe colds and for the flu, but you don't have to wind up getting sick. And joining us now to help us break down some of the symptoms of cold and flu and some ways to lessen the severity, Dr. Assil Saleh with Foxhall Internists in Northwest Washington. Dr. Saleh, thanks for being with us this morning.
Thank you for having me.
Can we talk first of all about just the difference between a cold and a flu? Because I know a lot of people I know are starting to feel something this time of year.
Absolutely, and this is the time of year. October is the time where flu season starts. And there have been some sporadic cases of flu that have been reported in the Washington, D.C. area. The most important difference is that flu can be a very severe illness. So it's acute onset, fevers, severe body aches, the chills, severe chest pain, cough, and so on. And the most important thing is its sudden onset. Once you have the flu, you know that you've had the flu because it's so severe. Whereas the cold, on the other hand, is a much milder illness. It is occasionally people do experience low-grade fevers. They can experience cough, typically productive of some sputum, sneezing, runny nose, most often a sore throat. The onset is gradual. It's not as acute as the actual influenza.
A lot of times maybe when we get that feeling, like you hear people say, I kind of feel like I'm starting to come down with something, that might be more of a cold symptom than a flu symptom.
That's exactly right. That's exactly right. And if you're unsure, it's actually always a good idea to consult with your healthcare provider. The reason is, you know, if it's truly the flu, the earlier it's caught, the earlier one can institute treatment.
Let's talk about some of the ways that we can go ahead and hopefully avoid either one. And does it work the same for avoidance, one versus the other, or is it completely different sets of things that would set this off?
Well, absolutely. Both are triggered by viruses. So avoiding them, you know, the common things that one can do are to wash your hands and avoid close contact with people who are sick. If you are sick with either a flu or a cold, try to stay home. Actually, influenza can be contagious up to 1 day prior to onset of symptoms and 5 days after onset of symptoms. And the most important thing is to actually get vaccinated against influenza. Vaccines are widely available at this point, and we recommend that everybody, actually the Centers for Disease Control recommends that everyone 6 months of age and older should get vaccinated.
We talked, I know last year we talked in depth about the H1N1 in addition to the seasonal flu.
Exactly.
As far as vaccination, it's combined this year though, right?
That's exactly right. This year the vaccine is combined. It's a triple vaccine, and it contains the 2009 H1N1, influenza B, as well as another strain of influenza A, H3N2.
You talked about, when we talk about the differences between a cold and a flu, and you said that the flu typically is it hits you more, I guess, at once. Any particular symptoms that you might notice at first where you might think, okay, maybe I should get this checked out a little bit earlier than if I just had a cold?
Yes. Typically, the fevers, although not everyone with flu does develop a fever, and the severe body aches. As well as a headache. Those are much more typical of influenza. If you do develop those, then please contact your healthcare provider. A lot of people qualify for antiviral treatment, which would be most effective in the first 24 or 48 hours of onset of symptoms. And there are a couple of those on the market, such as Tamiflu or Relenza, that could be given to people with such symptoms, and they would be effective at making the illness duration shorter and actually preventing further healthcare complications from influenza.
Not to mention the contagiousness for someone else.
Absolutely, absolutely.
We hope that you keep spreading the word, and hopefully you won't see as many patients this year.
Get your flu shot. That's the key.
Exactly. Dr. Saleh, thanks so much for joining us this morning. Best wishes to you. Allison, we'll send it back to you.
Oh, thanks, Dave. 8:21 right now, 61 degrees on